Hi, I'm Dr. Jim Carlson from the Grove Animal Hospital and Holistic Center, and this morning we're going to be discussing this case, 00409. It's a Newfoundland Poodle mix, about 5 months old, still an intact male, and the symptoms have been possible allergies. The red eyes and yeasty odor have been pretty consistent with this little male Newfie. And the results of the analysis showed weakened skin and stressed lymphatics, so teeth and jaw and lymphatic circle. And the lymphatic circle encompasses the lymph fluid itself, the lymph nodes, and also lymph ducts. And the ducts are, and then also muscle is incorporated into this because it takes the muscle to actually move to pump lymphatic fluid out of the area, depending on if it's the shoulders or the legs or the low lumbar area, for example. And so if those lymphatics aren't cleared, there's a lot of T and B cells and natural killer cells in that fluid that react to it and embark on that and create inflammation. And so in terms of allergies, allergies can be a tipping point, but not in this case, because you'll notice on the base point readings that the two allergy points were not producing toxin per se that's causing the skin condition or the allergens, and we're not sensitive. The environment looked pretty clean as well. So this is strictly genetic. This is how his body is clearing normal toxins, normal exposures that he wouldn't be sensitive to, but his system isn't able to clear it yet. And it could be because he's just 5 months old and his system needs more time, or it could be something that he has a deficiency in a certain enzyme or something like that. So until we clear this, until we strengthen the skin and reduce stress to the lymphatics, then we'll continue to see these symptoms up to some point where he's older. He may outgrow it or develop a stronger immune response. But what we want to do is help condition him. So if we look at it in terms of the elements, the heart and circulation encompasses our triple warmer and lymphatics. The GI tract encompasses the muscle part of this, and also the lung is also associated with the skin. So that's where you start to see the skin problems. And even kidney over here is responsible for the eyes. So if we see red eyes here, we see inflamed skin over here, even muscle soreness can be incorporated into that. And so those are the things that we have to clear. So how do we clear that? Well, we use the hemp oil infusion, so lymphatic infusion and skin infusion, and we give 5 drops every day for 3 months. So that'll help to clear this. But then we want to give something as far as nutrition. Right now, AC carbamide would be a good nutritional supplement. So that's the nutritional side. And at least in the short term, because it's lymphatics, we may have to be supportive with conventional therapy, but it's better that we clear it versus suppressing that. So as long as we're comfortable going through the process, it's better to go through the process with minimal intervention. So intervention would be like a steroid, for example, would intervene in the reaction. So it's not a remedy or even a cure, but it can stop the reaction. And what we want to do is help the process move along so we don't get into chronic conditions, especially with the lymph system. We don't want that to become reactive, because that's where the lymph nodes are. We don't want to get infected lymph nodes or really reactive lymph nodes or even toxic lymph nodes. Okay, so those are the two things I would start with as far as the remedy. In the meantime, I'd like to follow up in about 3 weeks, but if you're concerned and want a prescription for anything that's getting worse here, then we can prescribe medication more in a conventional way, so eye drops and antibiotics, and anti-yeast products like ketoconazole, for example. So, but we'll follow up in terms of whether we're going to need that or not going forward. Okay? So if you have questions, the video is helpful to kind of visualize it. can watch it over and over, but there still may be questions, so please call us 847-541-4005 and get those questions answered, or use our email, groveanimalhospital@gmail, and we'll check the email for answers for your questions, and we'll get those answers to you. Thanks so much.